Having your teeth pulled can be rough. That's why we created a kit packed with essentials to help you prepare and survive your dental surgery with ease. I'm Dr. Daniel Yang, board-certified oral surgeon, and I'm excited to show you what's inside. Don't panic if you experience some bleeding. It's totally normal. Let's go over how to manage it with the help of your recovery kit. First up, gauze. Bite down firmly on a fresh gauze pad and make sure to change it out every 30 to 45 minutes. This consistent pressure helps to form a clot. Curious what those tea bags are for? These are your secret weapon. If you encounter bleeding that won't stop with gauze pressure, dampen one tea bag, squeeze out the excess water, and bite down on it gently. Tea contains tannic acids, which help with blood clotting. Also, our proprietary blend is excellent for promoting intraoral wound healing, so you may prepare it normally and drink it for those added benefits. Remember, minor bleeding can last a few hours, but if it's heavy, continues for days, or if you're passing large clots, call your surgeon as soon as possible. Swelling after tooth extraction surgery? No worries. Your recovery kit has everything you need to conveniently reduce your swelling. Meet your new best friend, the Head Wrap Plus Ice Pack Combo. Wear your head wrap for 20-minute intervals with breaks in between to prevent skin irritation. Remember, swelling peaks in the first few days post-surgery, then gradually goes down afterwards. It's helpful to put those ice packs in the freezer before your surgery so that they're ready to go when you need them. Pro tip, elevate your head with pillows to help decrease facial swelling while reclining on a couch or on your bed. Keeping your mouth clean after a tooth extraction is super important, but how do you do it gently? Your recovery kit has all you need to effectively and gently clean your mouth. Say hello to your ultra-soft bamboo toothbrush. Avoid brushing your surgery sites for a few days, but make sure to gently brush the rest of your teeth. Your monojet syringe is next. Fill it with warm salt water and use it to gently flush the extraction sites after every meal and before bed. Salt water rinses help with healing and reduce inflammation. Make sure to dilute a few teaspoons of the included salt with warm water and rinse with the solution 2 to 3 times per day. The facial tissue packet is simply there for your convenience. Drool and bloody saliva at the corners of your mouth and lips are fairly common. Simply clean it away with the facial tissues provided. We know that recovering from a dental tooth extraction isn't always a walk in the park. Your recovery kit includes items specifically designed to enhance your comfort after surgery. Chapped lips are a common occurrence after surgery. Ensure you use the provided lip balm to keep your lips, especially the sides of your mouth, properly moisturized. Staying hydrated is crucial for surgery where there is expected blood loss. Electrolytes are very important for blood pressure control, cellular function, and pH balance. Take the provided electrolyte packets to properly stay hydrated before you undergo surgery, as well as afterwards. Your recovery kit has everything you could possibly need to properly heal so you can focus on feeling better and getting back to your normal routine.